Black fungus infection in coronavirus. Black fungus, also called as mucormycosis infection, is potentially a very serious and can be life-threatening condition if not treated. Recently there have been multiple reports of black fungus infection from India and Pakistan in patients affected with coronavirus. Currently the exact reason why patients who are critically ill with coronavirus infection is getting the disease is unknown, but this could be related to top-up infection in patients who are already critically ill. One possible reason identified is the use of steroids, but currently there is ongoing research to establish other causes. The black fungus spreads by coming in contact with the tiny fungal spores. Fungal spores can enter through the lungs or sinus after breathes in the spores. Similarly, it can enter the skin through cuts, burns, or skin trauma. The symptoms of black fungus infection depend on which organ or part of the body is affected. If lungs are affected, the symptoms include fever, cough, chest pain, shortness of breath. The chest X-ray and CT scan shows typical findings. Similarly, if sinuses and brain is infected, the symptoms may include one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of mouth that quickly become more severe. Patients with severe infection in the brain can develop mental status changes or coma. It has classical findings on brain scan. The features of skin infection in black fungus includes pain, warmth, excessive redness, or swelling in moderate infections, but in severe infection, blisters or ulcers are formed and the surrounding area may turn black. Milder to moderate symptoms of gut infection include abdominal pain, nausea and vomiting, and bleeding in few cases. In severe case, the gut can become gangrene requiring surgical removal. People with coronavirus infection must not use steroids without the assessment and prescription by doctors. Steroids reduces immunity and increase risk of the deadly mucormycosis infection. Certain groups of people are at higher risk of developing black fungus infection if they get coronavirus, including diabetes, cancer, organ transplant, stem cell transplant, long-term corticosteroid use, injection drug use, iron overload disease, hemochromatosis, skin injury due to surgery, burns, or wounds. The good thing is that black fungus is not contagious and does not spread between people. The risk of getting infection in healthy people is very low but very high in people who have weakened immune systems. People can prevent themselves from the black fungus by avoiding the places where it is common, including construction or excavation sites, with water-damaged buildings and contact to soil or dust. N95 or surgical masks should be used. No vaccine available against black fungus and therefore must follow preventive measure. Healthcare providers can diagnose the condition by considering your medical history, symptoms, physical examinations, and laboratory tests. The doctors might collect a sample from your body to send to a laboratory. Mucormycosis is a serious infection and needs to be treated fast, effectively, and timely, as delay in treatment can be a serious threat to life. You must follow the instructions of your healthcare professional. Most patients are started on antifungal medications via intravenous lines in hospitals. In severe cases, the affected area may need removal by performing life-saving surgical operation. We would strongly recommend that everyone should follow the coronavirus preventive measures, Get vaccinated and avoid unnecessary use of steroids without prescription.